much for allowing me to come and speak on behalf of thousands of people, particularly in the state of Massachusetts, where I work. I work on Project Bread's Food Source Hotline, and we're a confidential information and referral hotline for the entire state. We take over 45,000 calls a year in up to 160 different languages through our interpreter service. And we get a large variety of calls from people. I've been working on the hotline since 2008, so I've definitely seen a huge increase in calls over that time period from when I started until now. What we do on the hotline, as was stated earlier, is we provide application assistance for SNAP benefits. So people who call us, we can pre-screen them to see if they might be eligible for SNAP benefits, and then walk them through the process. So through the Virtual Gateway Application Assistance Program, we apply, and I will follow up with the clients throughout the 30-day period just to make sure they know how to proceed forward, what verifications to send in, what they need to know in order to get the benefits that they are eligible for. And aside from that, we also do turn people to different food resources, emergency food pantries and soup kitchens throughout the state, local farmers markets, the school meals for children, summer food for children as well. And because a lot of our callers call and they're not only having problems with putting food on the table, but for paying for rent and for utilities and medical expenses, we do refer them to a lot of other services as well. So what type of callers do we have? There's not one type of person that calls the hotline. It's a wide variety of people across the state. Massachusetts is known as an affluent state that's rich in technology and education, and yet there are so many people struggling to put food on the table and are struggling with food insecurity. We get calls from the inner city, we get calls from the suburbs, we get calls from rural farmlands. Everywhere in the state there are people that are struggling. So we receive calls from college students or recent grads that have just graduated and have their degree and they're ready to work, but they can't find work, so they need the extra help. We have calls from elders who are on fixed incomes, who are having to make a daily decision of whether they're going to put food on the table or if they're going to take their meds for the day. We get calls from parents with young children who are dreading the summer months because their kids have been on school meals throughout the year, and now they're coming to a time where they're not going to have those funds to pay for food during the summer months. So again, a wide variety of calls, and I would love to highlight just a couple of different stories just to put a face on the callers and the food insecurity that's out there. So last year we had a family that called, a woman who was calling. She had just a sense of urgency in her voice and desperation. She called to say that she and her husband, who had a family-run business for a long time, their business was going downhill because of the economic recession, and so they weren't able to make ends meet as they once were. They had 3 growing boys. One they were trying to send off to college, and the other 2 were younger. And she told me about how she would go through the grocery store and just have a sense of desperation that she wasn't able to get the types of foods that she needed to provide for her family. So because she wasn't familiar with the types of services that were out there, she somehow found out about Food Source Hotline and gave us a call, and it did look like she was eligible for SNAP benefits. So we helped her through the application process, and I remember her calling me when she was finally approved and got those benefits, and she just said, "Emily, you have no idea what a blessing it is to be able to go to the grocery store and come home and fill my pantry and fill my fridge and know that my children are okay and that we have food now." So that's one example. Another is a woman that called us on the North Shore, from the North Shore of Massachusetts. So she called us actually just last week. She was suffering from congestive heart failure, and so her doctor was urging her to eat specific foods, healthier foods, lower in sodium, lower in carbs, and she felt like she was in an area which is, there isn't a lot of access to to food, let alone healthy foods. And so she was having a hard time finding the healthy foods that she needed in her area. And there was one health store that she knew of, but it was particularly more expensive than what she could afford, and she didn't know quite what to do. So again, we pre-screened her, and it looked like she should be eligible for SNAP benefits, and she was eligible for around $58 a month. And she was so thankful to know that she would be able to at least buy some of the foods that she needed in order to get through the month. And finally, an elderly couple that called us from central Massachusetts. They were both on fixed incomes. The wife had called, and she was telling me about her husband and how he had a lot of medical problems. And they were having a lot of issues of having to pay for their mortgage and the property taxes, homeowners insurance, utilities. The list goes on, all of their medications that they had to pay for. And she told me that some days they would go with just one meal a day just to get by. She actually had a backyard garden, so she would grow as much as she could, and she would can throughout the year, but even still, that wasn't meeting the needs that they had. And so through the pre-screen process, we saw that she would be eligible for the family would be categorically eligible for $16, which is the minimum amount for a household. And even though it wasn't a ton of money to get them through the month, that $16 meant so much to her because she was going to be able to buy seeds so she could plant more in her garden, and a couple of extra things during the month to help them get by. So those are just a few of the stories that are out there of people who are really struggling and really want to put food on the table and healthy food for their families. I know that a lot of people who call us wait until the last minute. They call us and they have gone through their savings. They have lived off of friends and family for a long time, and they finally come to the end of the rope and they don't know where else to turn. And so they call, and they probably could have been eligible, months prior, but they're calling at the last minute because they don't want to have to reach out for help, and they don't want to depend on government assistance, but they know that it's the right thing to do to feed their families healthy food.